Thank you very much.
All right. Well, good afternoon, everyone, and welcome. As a co-founder and co-chair of the Bipartisan Addiction and Mental Health Task Force, I am so pleased to be joined by so many members of the task force, Democrats and Republicans, to announce our legislative agenda for the 117th Congress. I first want to recognize that September is National Recovery Month. Addiction affects every community and every congressional district across this country, rural, urban, and suburban, in every state of the land. We have been working for many years on previous task forces, the heroin task force, the opioid task force, and now the addiction and mental health task force, to find bipartisan solutions to address this overdose epidemic. But the COVID-19 pandemic has exacerbated the dire mental health and substance use disorder crises across our country. It is estimated that 93,000 Americans died of an overdose in 2020, the highest number ever recorded in a 12-month period. My home state of New Hampshire has been hit especially hard by the overdose crisis, with synthetic opioids such as fentanyl making efforts to end this crisis all the more challenging. I think of fentanyl just like I think of the Delta variant. It's causing havoc. Thankfully, we have a committed group of close to 150 bipartisan members of Congress, and you know this is a challenging time to come together. So we are proud of the work that we're doing to address this challenge, and I'm so pleased with the group standing before you today. First, I want to recognize the leadership and work of our co-chairs. My colleague, Representative Brian Fitzpatrick from Pennsylvania, is our Republican co-chair. Congressman David Trone of Maryland is our Democratic co-chair, and Congresswoman Jamie Herrera Butler, who sadly could not be with us, from Washington State, is our second Republican co-chair. So we are so grateful to your work on this issue and your commitment to ending the epidemic. As a task force, we are constantly exploring how we can encourage innovative programs in our communities and spread them throughout this country to combat this public health crisis. In New Hampshire, we've seen tremendous success at the county and state level, providing medication-assisted treatment to our incarcerated individuals with opioid use disorder. So I'm pleased that my bipartisan bill, the Humane Correctional Health Act, is included in our bipartisan agenda, and we're so pleased to be rolling this out. I hope you'll get a copy, and please spread the word widely. The Humane Correctional Healthcare Act will improve access to treatment for justice-involved population and build upon the success that we have seen in our state, helping people get back to their lives, back to their families, back to being productive in the economy. This isn't just the right thing to do, but it actually improves public safety and saves taxpayer dollars. This agenda includes legislation aimed at both mental health and substance use disorder. We call these co-occurring illnesses. And we are pleased that several of the bills included in the agenda have already passed the House and are awaiting action in the Senate. This task force is committed to working across the aisle to achieve real results in the lives of our constituents. This updated agenda represents our commitment to helping our communities to prevent, treat, recover, and rebuild. And to our members, we have a lot of speakers, so please try to keep your remarks to 1 minute. And at that, I'd like to invite up our Republican Vice Chair, Representative Brian Fitzpatrick of Pennsylvania. Brian, thank you for your leadership.
All right, thanks, Annie. So we've all been experiencing the physical health side of COVID-19. Hopefully, we're on our way out of that. We will get out of it. Phase 2 of COVID-19 is going to be the addiction and mental health crisis, and we're already seeing it manifest. and it has for quite some time. So if you look at the trajectory, pre-COVID, we were moving in the right direction on a lot of metrics. Once the COVID spike occurred, all the elements of relapse occurred. You had quarantining, you had isolation, you had people not having access to services and treatments, you had joblessness, financial constraints. All the boxes were checked for relapse, both for mental health issues and addiction issues. So here we are. And there are a lot of task forces in Congress, as you all know. None are as large as this one. None actually are as active as this one. And yes, we actually have a legislative agenda to back it up. And that's the key, because a lot of people talk a good game around here. A lot of people talk about bipartisanship. They talk about legislation. This is truly bipartisan, and it is actually focused on legislation. This entire legislative agenda, which David and Annie and their staffs did a tremendous job on, this has been the product of a lot of work. What we've done is we've identified the entire continuum of addiction and mental health, from education and prevention on the one end to treatment and recovery on the back end, and then everything in between. And we try to find the gaps in the healthcare system, the gaps in the insurance industry with regard to parity, gaps in the federal regulatory system, like the bill that I've been really pushing, the Road to Recovery Act, which will eliminate the antiquated IMD exclusion, which actually prejudices and discriminates against people that choose the inpatient treatment route for both mental health and addiction. So this is a very real task force. It's active. It's active because of the leaders and the people that take the time to put it in. Mental health issues and addiction issues are by far the most pervasive problem we have in this country. It's the most under-recognized, it's the most under-diagnosed, and it's the highest stigmatized. And stigma is a polite way of saying prejudice and discrimination, which is why it's important that we get into the schools, and everywhere where we're focusing on physical health and physical education, there also ought to be mental health education. There also ought to be education on what substance use disorder is, that it is not a moral failing, it's a medical condition just like many other. And start to have those open, transparent conversations so we can lift people out of the shadows and get them the help they need. With that, the man who's injected a ton of infusion of energy into our task force, David Trome from Maryland.
Hey, David. David Trome. Nice job. Oh, that's mine.
Oh, that's yours.
Thank you, everybody, for coming here today. And I really want to thank your awesome co-chairs. I mean, we just had a dearth of great ideas on a huge problem we have to face. But what I love about this is comprehensive. This is almost 70 different pieces of legislation that attack, as Brian said, all the different elements. And I want to also talk about what I also love about this, and that's the bipartisan piece that we have here. Because in today's world of extreme partisanship, it's so refreshing that we can come together, we can be together. We had over 200 people on the Capitol steps early this week, led by Speaker Pelosi, but also Leader Scalise was right there with us. So it's everybody coming together to attack this problem. No community today, no neighborhood, no family has gone untouched by the drug addiction. 3 years ago when I ran for Congress, I heard from countless families that had lost loved ones. We've never forgotten their stories, their heartbreak. Today I stand shoulder to shoulder with our colleagues to spearhead new initiatives to combat the opioid epidemic that our country continues to grapple with every single day. These efforts will build on the efforts already that the task force has accomplished and deploy proven and effective solutions. I'd also like this opportunity to recognize that this is based on common goals, united hope, and trusted bipartisanship. That's really how Congress should work. Every member has worked faithfully across the aisle to stop this flow of dangerous drugs. We must remember that putting an end to this epidemic will not just take one representative or one party, but an all-hands-on-deck approach from every corner of our country. The legislative priorities of our agenda will do just that. Throughout the work, the task force has over 70 bills to combat mental health and addiction. And as Annie said, they're tied together at the hip. These pieces represent tailored approaches, tailored to best fit individuals and their needs, whether it's a veteran struggling with PTSD or a family member raising a child in need. Lots of you, like all of you, I've experienced the impact personally of the addiction crisis. And during COVID, Maryland's had double-digit increases. One of my counties, Allegheny County, deaths are up 111% from addiction. So new data shows Black, brown, and indigenous communities are seeing some of the worst increases in overdose deaths. These sobering statistics have helped us put together so many bills to attack this issue. I just want to speak about one bill, and that's CARA 3.0. This is a comprehensive bill tackling what COVID-19 has done to the addiction crisis and mental health. It builds on the previous CARA bills, increasing funding for education, prevention, research, treatment, and recovery during this critical time. So we call on our committee chairs to consider these bills quickly, because lives are lost every day. It goes without saying we have a lot of work to do, and our communities, they're counting on us. They're counting on us. It's time to get to work and save lives, and I want to thank again everybody in the task force for their support.
Thank you, David. Thank you for your energy. All right, from here on out, we're going to go strictly by seniority. I'm going to call on Buddy Carter from Georgia and then Marcy Captor from Ohio.
Well, thank you, and I want to thank all of my colleagues who are here today as part of this bipartisan committee. And what David just said is extremely important. As many of you know, I'm a pharmacist by profession. I've witnessed addiction all throughout my professional career. Addiction does not discriminate against anyone. Republican, Democrat, Independent, Asian American, African American, Caucasian, doesn't matter. Addiction is a disease. It's a disease that we have to address. Now, we've done a pretty good job in the pharmacy community of making sure that illegal and illicit drugs don't get through the pharmacy. We've done a good job with that, but we've got to address some other areas within our society. Specifically, we've got to address the internet. Too many drugs, too many illegal drugs are coming across the internet. Now, serving on the Energy and Commerce Committee, that's going to be one of my biggest priorities and has been and will continue to be. That's something we have to address. We've got too many drugs coming from China, laced with fentanyl, too many drugs coming through our post office. Already this year, the post office is estimating that they will confiscate 3 times as many illegal drugs coming through the mail as they have in the past years. Now, that's significant. Also, don't forget the southern border. And what we all talk about, the illegal immigrants coming across there, it's more than just that. It's illegal drugs as well. First 4 months of this year, enough fentanyl has been seized to kill every American 4 times over. And just as David said, addiction and mental health, they are attached at the hip. They do go together. One of the things that we have recognized during the pandemic is the importance of telehealth. And that's why we need to make telehealth permanent. And we need to continue it on. It is a great asset, a great tool in our tool chest to deal with mental health. Mental health is serious. Again, it impacts everyone. It's not discriminated against anyone. We have to address that. I want to thank these people behind me and other members of this bipartisan caucus who are working to bring about help and relief in addiction and in mental health. It is extremely important. Thank you, and God bless you.
Thank you very much. I want to thank my colleagues, Annie Kuster, Brian Fitzpatrick, Donald Trone, and Jamie Herrera Butler for their leadership efforts. I actually began my journey to join this group with a deep interest in neuropsychiatric illness and behavioral health, and understanding the connection often of addiction, where people attempt to self-treat and then become, unfortunately, addicts. So what we are doing today has such personal meaning. Yesterday, I spent part of my afternoon trying to counsel a fellow member on a sibling of that family that had fallen mentally ill, in that individual's 40s. So this is something that happens to people throughout life, depending on, it doesn't matter, man, woman, child, adult, male, female, whatever. The tragedies that we see across our country are truly heartrending. So we speak on behalf of the mental health today of children, seniors, parents, workers, always at the forefront of our minds. On Sunday night, I met with individuals who work in our emergency rooms across the region I represent, and the patients that are coming in are more violent. Several of our behavioral health counselors have had hands broken. They've been knocked to the floor. The situation that is facing this growing crisis is truly daunting. And until true parity is achieved for mental illness and behavioral health, conditions will not change. I want to highlight our strong allies in this administration on these issues, and truly we need their help, and I know that the President's wife, Jill Biden, is extremely interested in this issue. 12 years ago, Congress passed the Mental Health Parity and Addiction Equality Act. I voted for it, which requires insurers to cover mental health care and substance use disorders at the same level as other health care services. But I can attest to you, in the places we represent, if you have one of these conditions and you are unfortunately arrested and go to jail, your Medicaid coverage is cut off. It's unbelievable. So in the prisons that I represent, nearly half and sometimes more of the inmates have mental illness that is undiagnosed and untreated, oftentimes with a comorbid substance abuse. It is truly inhumane. We must hold insurance companies accountable and halt the tragedies unfolding across America. I commend all of my colleagues for their care and attention to this magnificent legislative agenda, and I know that we will all continue to fight until true parity is achieved. And let me say, like my Republican and Democratic colleagues today, boy, does it feel good to work with a bipartisan group of members who understand a major national need and are working to address it. Thank you so very much. And we now turn to...
I'm introducing my next...
Okay.
Next, we have my colleague and friend from the state of Pennsylvania, Dan Kuster. Dan, come on up.
Well, thanks, everyone. Really appreciate you all being here, shedding light and bringing this issue to as many people as possible, because it is so important. I can't thank my colleagues enough for their presence here, as well as all the work that's been done. David Trone, for instance, we got a little bit of a drone up there. David Trone came to Congress with a number of missions, but there's simply no question, anybody on the House floor knows that this is something that he's very, very passionate about. And I respect him so much for the work and the diligence and the care and the love that he puts into this for personal reasons, but for the greater good. And that goes for everybody here. You know, in my district, I have one county, 140,000 people. We had 146 fatalities last year. This year, we're almost at 100 already, and it's not getting much better. So the work that we're going to do in legislation, but there's more. There's more, folks. There's some things that we've got to face. The southern border, for instance, all right? The level of fentanyl is up, 500%? That's got to be taken seriously, more seriously, frankly, than it is right now, and as well as law enforcement. And more drug task force in these counties. So, hey, this is a great start. This legislation's a great start. I'm very, very honored to be here, but this is a very serious subject. I think all of us have probably been to a funeral of a young person who did not deserve to be, because it's an addiction, in that coffin and lose their life. And I'm just very glad to be here with all of these folks and all my colleagues and continue this important work. So thank you.
Great. With that, we'll go to Sheila Jackson Lee from Texas.
Thank you very much. Let me thank, we call her Annie, David, Brian, and Congresswoman Harry Butler for the approach that brings us all together today. I am the chair of the Crime, Terrorism, Homeland Security Committee, which would be perceived as the hard hammer on dealing with the questions of drugs. But I'm very glad to say that we have turned the corner to be a part of the message and the mission of the Bipartisan Addiction and Mental Health Task Force. I want to share some environmental information as it relates to the issue of drugs. I think someone is trying to
Protecting you from the wasp here.
as it relates to the issue of drugs. There are a lot of environmental factors that increase a person's risk of addiction, including a chaotic home situation. In fact, this morning we heard a story of a little boy who lived in a rat-infested home, and what he did at night was to try to keep his sister safe from the rats. What does that do to his little mind in terms of frustration and being overwhelmed as it relates to mental health? So you have parents with drug abuse, the attitude toward prescription drugs in the home, the poor academic achievement. All of these combined with the stress of living can turn people toward the suffering of mental health issues, but as well the suffering of addiction. So I support enthusiastically the issue of intervention. My legislation in the reduction of criminality of drugs, working with the Senate, is going to focus as well on the issue of prevention. I am delighted that we have a recognition that suicide comes from drug use on instances, and of course mental health issues as well. Tragically, we have seen stories that are dealing with hazing. Someone would ask, why is she raising that? Where we're forcing young people to overdose on alcohol. All of these elements, culture, the way we treat these are going to be very important, and this bipartisan committee should be very much in the forefront of changing the culture, the attitude, and putting a big capital P on the word prevention. I want to say to families, mothers and fathers, I want you not to suffer alone. I want you to ensure that in the immediate signs that you see in your household with your children, that's who we need to save. That you can redefine mental illness, you can redefine addiction, and you can get help. And the legislation that, under the big word prevention, that we have here in this bipartisan legislative approach, we're going to save lives. And so I conclude my remarks by saying I'm standing here with lifesavers. I'm standing here with people who will not condemn parents or their children or their households for having addiction in their household, for having mental health issues in their household. We're not condemning them. We're standing here as partners to say, take our hand. We're going to help, and America is going to be able to save lives and to help our families steer their lives back to a better quality of life. We pray, we fight, and we will win.
Thank you, Sheila. And with that, Paul Tonko from New York State.
Thank you, Annie, and thank you to all of the co-chairs of the task force for your leadership. Thank you to all of my colleagues. It's an honor to join with you in this bipartisan caucus because everyone has to respond to this looming crisis in America. This weekend, when I was home in my district, yet another numbing moment. A mom telling me, a good friend of mine, that her 30-year-old daughter is the latest statistic. How tragic. How demanding of us to meet the challenges of the times, to put forth the policy, advocate for the resources, bring together a spirit of hope for families who suffer tragically from the illnesses of addiction and mental illness. It is important for us to stand together and get things done. So for the short time that I'm allotted, and rightfully so because it's a large group, let me just go through the 4 items that are included in this wonderful task force agenda. First, the Medicaid bump back for me. It is difficult to get professionals to respond to the needs of our constituents. It's a tough thing to recruit the talent. We would Medicaid bump up those who are hired to serve Medicaid patients from the federal perspective. An important incentive, I think, to draw the talent we need. Second, the Medicaid Reentry Act. Far too many people are incarcerated and are struggling from the illness of addiction or mental illness. We need to provide services in the thousands of incarceration centers in this country. A relative few do so now. And so we can save lives. We know that those who are released, recently released, are 129% more vulnerable to die from an overdose because they have been taken away from the menace of those drugs. Third, the work that is being done in our effort to create the medication-assisted treatment. There are outmoded, useless hoops through which our professionals have to jump in order to serve the general public. If you can address patients' needs for pain management, why shouldn't you, with that talent, that education, and that certification, be able to address the needs of those who are addicted? So this would take away that undue pressure. And in France, where they experienced this, they had a drop by 79% of deaths due to overdose. So we need to go and be modernizing our bureaucracies so that we don't weigh down those who want to serve the general public. So it's important to do that. And then finally, we're going to continue to fight to make certain there is research done because of COVID. Brian talked about the physical impact and now the looming challenge of the mental health impact of COVID. I have authored a bill that would require a study through the National Institutes of Mental Health to study the impact on frontline workers and children, especially in our research, to provide for the best blueprint possible as we allocate funds. Let's use them most wisely. So my thanks to the Addiction and Mental Health Caucus for being a task force, for being able to promote these bits of legislation that I think are relatively extremely important as we respond to the challenges. We must win. Failure is not an option here. And as one who delivered on mental health parity in the state of New York, which preceded the federal bill and was the first state in the nation to advance mental health parity, I'm proud of the work that we can do with this task force. Thank you, one and all.
Yay, thank you. Okay, Don Norcross, and then Debbie Dingle, and then Lisa Blunt Rochester.
Thank you, Annie, Brian, David. Appreciate coming. National Recovery Month, because people do recover. And we need to remember that. With the stigma that is attached to it, people do recover. But unfortunately, during this pandemic, the highest amount of overdose deaths in our nation's history, over 60,000. We've all lost friends, loved ones. Almost 11 years ago in Congress, as you talked about, Patrick Kennedy sponsored the Parity Act, which said if you spend it for the physical, you have to spend it for the mental. We know how important that is, but it's been lacking one thing, and that's enforcement authority. Well, here's some good news today. It is in the reconciliation bill. When we pass that, we're going to get that parity. And that is just a linchpin to getting those who need the help. Those insurance companies who didn't want to do it now must do it, not only for the right reasons, but they have to because it's the law and it's going to hurt their pocketbook. We shouldn't have to do that. My God, 60,000 people a year and you don't want to cover that? It's a national embarrassment. I just want to keep it short and say we're all in this together. It's ironic when we have new members join, it's usually because of a loss they've experienced. So from that perspective, we want no new members because we don't want anybody to have to experience this to do the right thing. We all should be doing that. I yield back.
Debbie.
So I'm just going to be short. I am short too. I want to thank all of the co-chairs and everybody that I work with here. You've seen the legislative agenda. I hope you will read it. I've got some bills in there, but I'm working with everybody behind me. But I guess I have just a couple of messages today. I'm here to put the human face on this. I grew up in a home my father was an opioid addict before anybody knew what it was. And I know the consequences of growing up in that kind of home. I lost my sister to a drug overdose. And to protect my family's privacy, I'm not going to tell you the latest member, but he was found with the needle and the syringe and the fentanyl in his arm. That fentanyl is real. People need to know it is not safe to buy drugs on the street. But what we have to do is to remove the stigma. Mental health is something that impacts every family, every community across this country. And that's what we're here to do, to attack the direct problems of why we see so much addiction in this country, but to also, we need to, I'm sure my father self-medicated. We didn't talk about mental health then. He was probably bipolar. I know my sister had issues. I'm not afraid to admit it because it's real and in every family. So we've got to work together to remove that stigma, address the issues of how we get people the help they need, and they know the danger of taking these drugs. Thank you.
Hi, Mary Gay Scanlon from Pennsylvania's 5th District. The effects of substance use disorder extend far beyond individual suffering, impacting entire families and particularly children. Nearly 2.7 million children across the United States and over 200,000 in Pennsylvania are currently being raised by grandparents, other relatives, or close family friends. Their numbers are growing in large part because of the opioid epidemic. So as we work to combat the opioid epidemic and support those suffering from substance use disorder, we also have to address the unique needs of kinship families. Before coming to Congress, I saw firsthand the challenges faced by kinship caregivers when I represented multiple grandparents who were struggling to overcome the legal, financial, and emotional challenges of caring for grandchildren when the parents were unavailable due to opioid addiction. I'm proud that the Bipartisan Addiction and Mental Health Task Force's 2021 legislative agenda will again include my Help Grandfamilies Prevent Child Abuse Act, bipartisan legislation that helps address the unique challenges that grandfamilies and other kinship caregivers face. The bill will ensure these families are eligible for services under the Child Abuse Prevention and Treatment Act, or CAPTA, and provide support to meet the unique needs of children who've experienced trauma, including exposure to substance misuse. I want to thank Chairs Kuster, Fitzpatrick, Trone, and Herrera-Butler for their leadership in working across the aisle to advance evidence-based legislation and steps to support those struggling with and affected by mental health challenges and substance misuse. Thank you.
Good morning, everyone. I'm Lisa Blunt Rochester. I represent the state of Delaware. And I first want to start off by saying thank you so much for the leadership that my colleagues have shown in a bipartisan way. Annie, Brian, David, and and Herrera Butler, who is not here. And I also want to thank all the members who have participated. This is probably one of the areas that from my first day in Congress, I joined this task force because it affects my state so much. And I think you've heard already from all of us. It affects our families, it affects businesses, it affects our communities, it affects our public safety, it affects all of us. And I was proud to introduce 3 bills that are included in this package. But I think what is really stunning is that we already had problems, we already had challenges. But when you have economic stressors on top of a pandemic, on top of a racial awakening, it is a recipe. It is a recipe for what we're dealing with right now. And so a few of my bills, 3 of them are in the package that I co-led, and 2 focus on children, because I'm very concerned that children, our future generations, if we don't deal with the issues of substance use and mental health, it will carry on and it will become a legacy. I also have a bill called the Moms Matter Act. And the Moms Matter Act is important because it also deals with the workforce. We in our country have a maternal mortality challenge, as we all know. The worst in one of the richest countries in the world. And part of that is because we need to make sure that we have individuals who know how to provide mental health and substance use services to pregnant individuals so that they can get the help they need. I will end by saying I'm also proud to be a part of and a co-lead with Annie Kuster on the Stop Fentanyl Act. In my state, I've been traveling around in August, and it was interesting to meet with guys who had just come out of prison, to meet with students, to meet with a lot of folks that talked about fentanyl and how it is in everything. To see people on a corner in your town that are just bent over, not even living, to know that we have family members. That bill is important, and I'm proud to be a member. But I also want to add, while this is bipartisan, I'm in the Progressive Caucus in Congress. I'm in the New Dems, the business-friendly caucus. I'm in the Congressional Black Caucus. I'm in the Women's Caucus. I'm an assistant whip. And what I can tell you is that this cuts across everybody. It's already been said. But the reason why I want to highlight the Congressional Black Caucus as well is because I remember my first meeting on the task force, and I said, where is everybody? People don't realize that we are disproportionately impacted by mental health and by substance abuse. And that at one time, heroin was mainly thought of as us. And the reason why in the pain pill killer time it wasn't us is because doctors and others didn't prescribe to us. And so even just making sure that we focus on the children, the moms, people of color, employers, we have to be comprehensive in how we deal with this, because it's not a one-size-fits-all. It's not one group that's affected. We're all affected. And so this document right here is the substance of thousands, maybe millions of voices in our country. It's the substance of legislators who came together across backgrounds. And it is the substance of help and hope. We are here to tell people help is on the way and hope is on the way. Thank you.
And our new colleague, Frank Mervan.
My name is Frank Mervan, and in light of the baseball game today, I'm batting cleanup, and this will be the first time I'll bat based on my basic baseball skills. So this is a vital issue, and as a freshman member of Congress, I bring my experience with me. We all have our life experiences that draw people here to motivate them and inspire them. I was an administrator of poor relief where thousands of people came in who needed assistance. The proportionate amount of people who had addiction and mental health issues, who were incapable of working or not having the ability to have a quality of life, impacted me. I was able to put a 5-county-wide addiction committee together in order to tackle that. And what we focused on and what we made sure, and when I looked into the eyes of people who did not have hope, who did not have inspiration, who did not know where to turn when their family members, when it was unfolding in front of them that their death was imminent, that they needed hope and they needed inspiration. Today, we have a bipartisan collaborative effort who are focusing on their missions and their inspiration to be able to make a difference in people's lives. And when I looked into their eyes and I saw individuals who did not have hope, this gives them hope. This gives people access. One other example I want to give very quickly, it was in February of 2019, there was an Arctic breeze that came in through northwest Indiana, Gary, Indiana. It was 60 below. We did a Narcan training. Over 160 people showed up for that Narcan training, and they weren't addicts. They were family members, grandparents, and friends who knew what was at stake. And our county only had access to 53 beds. Pieces of legislation like this and prioritizing mental health and addiction will make a difference to those families who truly feel hopeless. I also had a family member who was abused as a child, turned to opiates at a young age, and left 3 children behind. This isn't just as a piece of legislation. This is something that will change people's lives and save their ability and save their life. So in closing, I want to thank the co-chairmen for stepping up. I want to thank everyone who shared a personal story to make it real. And may we use our experiences in life to help guide and motivate and prioritize what is important and making a difference in addiction and mental health. Thank you very much.
Thank you, Frank, for joining us. There we go, everybody. Everything's been said, and now everybody has a chance to say it. So, any questions for the co-chairs or for the other members? Yeah, go right ahead. Hi. We try to be very comprehensive, and we will be working with the committee chairs and with committee staff on all of these bills. So we can't really say it's only prevention or it's only treatment or it's only long-term recovery. It is a very comprehensive approach. A number of these bills you'll see have already passed the House, so we'll be working with our Senate colleagues to include them. Some of these bills are included in the reconciliation package, and more will be coming. We don't approach it that way. Everybody has an equal voice. Unless you want to say something different?
What was the
our bills. We like our bill.
Yeah, I think really, I mean, all these are a priority. They cover, as David said, the entire continuum. Where we start, I think, you know, what our plan was to work in collaboration with the White House to find out what their priorities are and hopefully marry them up. You know, one of the things that I'm a big fan of, all of us are, is if we could have an entire week here dedicated to mental health and addiction legislation. We've done that in the past for animal rights legislation. We could do it for this. And I think that way all the advocates can come to DC, to the Hill for 1 week, and we can get all these things voted on. And that's the theme for the week. I think that's the way to go. But I think as far as how we prioritize what's in here, I think we got to marry our priorities up with what the White House is.
And we have already started those conversations. So the task force also has typically at least monthly gatherings with expert speakers, and just last week we were with the Office of Drug Control Policy, the acting director Regina LaBelle, and so we talked about our priority bills with her, and I think that's a good way to put it. We'll match it up with where the committees are going, try to influence what gets to the floor as quickly as possible. Yeah, thanks. Go ahead.
Just kind of answer this question, but yeah, I wanted to ask about what comes forward. Do you give any indication of leadership from the community leaders that they're saying, we want to do this? And I guess the other question is this the kind of, do you think that all these will come together in one, like the way you did yours?
They definitely could. I mean, David's got the CARA 2.0. Brian and I have the Road to Recovery Act. So I can definitely see as we move forward in the next few months that we would start to pull these elements together into packages. I don't mean to make it sound that's just all, going off in different directions. It's all of a piece. But it's a number of different committees. So I serve on Energy and Commerce with a number, Buddy Carter, some of the others. We're talking to Energy and Commerce committee staff and to Mr. Pallone about moving these bills and perhaps doing a addiction and mental health week. We did that a number of times before CARA 1.0, CARA 2.0. So I think you'll see that start to happen.
I think that's the real mission. Get before Energy and Commerce, Chairman Pallone, Captain Morris Rogers, together the team, are both very receptive and have a whole focus on mental health and addiction and bring everything together.
And also keep in mind under the House rules, if we get 290 co-sponsors on a bill, it puts it on something called the consensus counter, which means it's scheduled for a floor vote.
So the way we start out, we've only included bills that are bipartisan. We identify these bills to share with our colleagues that have an interest, and then you'll see the numbers start to tick up. Members will go through this and say, yeah, I care about that. I didn't realize that was out there. We're just trying to draw attention to some of these priority bills. Yeah. Anyone else?
All right. Thank you, everyone.
Thank you so much for your patience. Thanks for being with us.
Thank you, everybody.